this. All right, so this is just an overview on advocacy. The learning objectives as listed are to define advocacy, identify 5 types of advocacy, the scopes and limitations of the different types of advocacy, and what your role may be as a support group leader, if that is your role. State 5 attributes of successful advocates, identify barriers and risks to successful outcomes, identify when to access a professional advocate, talk about what professional advocates are, and then state the scope of the support group leader as advocates as it relates to group members, the medical community, and lawmakers. This will be a very brief overview. I have half the scheduled time, so forgive me if I move quickly. So my question is, what does advocacy mean to you? And I ask this question because it's a fairly new field. It's not well defined. And even if you try to Google what advocacy really means, you'll find several definitions. If you ask people, you'll see that there's many different responses that you'll get. Advocacy really became popular in the sense of really, it came to mean many different things with the Komen Foundation. They really took on advocacy and empowered people in a way that hadn't happened on a large scale before. Then online changed that game even further, social media. So there's many ways you can be an advocate. And so these are some of the ways that we've done it at DSN over the last few years. But I want you to just stop and think of what it means to you when you first have that thought now, and then we're going to revisit that at the end of the presentation. So the Merriam-Webster dictionary is what I went with for the most standard definition, and you'll see here what that is. I'm not going to read each slide because we do have such a short amount of time, but the act or process of supporting a cause or proposal, the act or process of advocating. So this pretty broad definition. You'll see many different if you take the time to look it up online. And these are different places in the community and online that you may find an advocate. Advocates can be extremely helpful in navigating this journey with complex mental health conditions or any type of disability. And they can be family members, spouses. They should always be an adult, but sometimes children of legal age can be a great advocate, especially those that have personal experience or any kind of training in the medical field, or if it's an educational advocate, any type of training in that background. It really is good to just have somebody in the room, sometimes a trusted friend. There's data that suggests even having a male in the room that doesn't speak might get you a better experience with a physician that might be a little biased against females. There's all kinds of reasons that you might want to have somebody there if you have brain fog or other issues, or someone to help with the communication barrier. So there's lots of ways to be an advocate. Attributes of successful advocates are listed here. Having clarity of purpose, having clearly stated goals and objectives. People struggle with this more than you would believe. They go in, they're geared up, they're ready. What am I asking for? They don't think about it until they get there. I'm going to tell them my whole life story about everything. It's better just to have clearly stated, short goals and asks when you walk in. Typically, you're not going to have a lot of time, so you want to be organized. You want to be careful that you're always respecting confidentiality. You're focused on action items that are empowering, that people typically want to help you. You have to make it easy for them to help you. The easier you make it, the more successful outcomes you'll have. You want to have respect for everybody, and you want to withhold judgment. So this is many ways you're going to advocate. So this is applicable to really all those situations, whether you're sitting with somebody in a doctor's office and trying to help them get the outcome they want, or if you're in a large-scale advocacy effort to go to lobbying days and go visit with legislators. No matter what you're doing, these are just good overall attributes that tend to be successful and have good outcomes. So you always want to exhibit good emotional control. You might see some things that you don't like, and they may upset you, but you want to keep your emotional control and try to be the calm presence in the room and negotiate well. You need to be a good communicator, knowledgeable about the subject or group that you're advocating for, and consider this is really important, consider the perspective of the audience that you want to influence. So think about that before you go in. If you know you're going into somebody that's biased in one way, you want to have a different approach maybe than someone that's on, an ally in the argument. So having that strategic approach helps. So there's different types of advocates and different types of advocacy. So this is a few of those types. Self-advocacy, the ability to understand and effectively communicate one's needs to other individuals without compromising the dignity of oneself or others is important. And then there's peer advocacy, taking action to represent the rights and interests of someone other than yourself, such as a family member, friend, or support group member. So this is something that everybody can do. Everybody can become really an expert in self-advocacy and peer advocacy. This is for everyone, and everyone should start here. After you master this level, then you move into the group advocacy level, and that's taking action to influence social, political, economic systems to bring change for groups of people. And that's when you start engaging on a larger scale with awareness events and lobbying. And self-advocacy is really, as I said, the building block, the start of it all. And I can't stress this enough. And I really, really believe that this is something that should start at a young age. And when these skills are mastered, it sets us up for success in life, not just advocacy. Start it by defining a goal, identifying necessary steps, choosing the learning strategies, and knowing when to reach out for support and help is the important part. Knowing when this is beyond my ability to have an effective outcome, and saying, I need more help because there are many different levels of advocacy and I need someone to come in and help. These are great steps to remember, and it's important to use the entire team of advocates to get the outcome you want. Parents can model self-advocacy skills by encouraging children to engage with healthcare providers during visits and encourage them to find their voice young. And not speak for their children, but be silent and allow their children to speak for themselves. This is very important because I know as a parent myself, you have a little bit of a time and you just want to tell them everything. But the best thing we can do is sometimes just be quiet and let the child explain what's going on with them. And sometimes you want to talk to them beforehand and say, Mommy's going to be quiet because I want you to feel comfortable in this setting and speak for yourself so they don't, they don't think something's wrong. You want to prep them for that. But it's really important that our children have their voice because we really want to build youth advocates. It's very important that they have these skill sets, and when we do that, this is what they do. And they can use their talents and their gifts, and it really helps them to build self-confidence and master essential life skills that will help them in their education and so many other ways in their life. We want them to also be able to inspire and mentor other peers in their community, raise awareness, and use whatever they have to really enrich their life and not be defined by their illness. So it's very empowering when we can do this with our young people. We also want them to have fun. Advocacy does not always have to be an adult experience. So what we do at DSN is we have a fundraising team instead of a fundraising team, and we like to have a good time. So we do a lot of programs, and we have a lot of fun. In everything that we do, we raise awareness, and we have advocacy infused. But I think youth programs specifically need to be engaging and fun and tailored to the interest of the youth. And a lot of that means online at this point, so it's important to do that. So find things that they're interested in, engaged in, and build programs around them. That is Kathy, you were there. Yeah, that was Kathy. That was at the Ehlers-Danlos Society conference, I think last year. Have fun. it's okay to have fun and be an advocate. There's no rules. The beautiful thing about this, it's not well defined. It's a new evolving career, and that means you can't really screw it up, right? So don't be afraid, and define your own path. Don't feel like you have to do it the way somebody else before you has done it. There's a whole new emerging field, and you could really create something wonderful if you use your imagination. So non-professional advocates are very valuable. You don't have to get your doctorate to be an advocate. Be you, and have a good time, and find the needs in the community and go in that direction. There are several ways to advocate even on the state level that are very, very impactful. So find what works for you. And advocacy is scalable and accessible. Everything we do for advocacy at DSN, we do in a scalable, accessible way. And if you want to be an advocate and you feel that you're homebound or you have some limitations that are keeping you from doing it and you don't know how to get engaged, contact us and we'll help you figure it out. You can do it from home. CSF has also letter writing and postcard opportunities. There's many ways to do it, but it may be hard to see that from where you're at. There's many nonprofit organizations who do this. There's RDLA, we work with them, we work with NORD. They're out there. We will give you the resources and the links to find the right one for you, but don't think because you're not able to travel to DC that you can't be an advocate. There's 100,000 ways to do it. The group advocacy, there's also your style. You do it your way. These are some of the ways our volunteers do it. And this is a rare art. So Missy's in our artist club, she received this award at Rare Week in DC, and for the Rare Artist Award this year. And she's from Arkansas. She makes amazing artwork underwater. She goes underwater and paints, which I'm like such a fan, right? How amazing is she? But she has dysautonomia, and she spends time in the pool. A lot of us use water for compression. And she started looking through the water and that's painting, and she's amazing. I have so many inspiring, amazing people in my life. But anyway, this is advocacy. So what's your talent that you can use to be an advocate? People don't realize that you can use your talent or gift and educate people and spread awareness this way as well. It doesn't have to be the way somebody else does it. So you have an experience to share about the patient experience yourself. You're an expert too. Just like everybody that you go to see at the conferences, they're an expert in their field. You're an expert in your field, and your field is you and your experience. So be willing to share your experience, whatever it is. If it's parenting a child with chronic illness, if it's being a spouse of somebody, you have something to share, and be willing to share that. Tell your story, tell it well. Hospitals and insurance companies, just so everyone knows, they do employ professional advocates, often, not always. And if they don't have one, you can ask for a patient representative. Also, sometimes that's another word for them in a hospital. Ask for a social worker, ombudsman. I've been around a while. That's kind of an old word. I didn't realize people didn't know. So I have a definition next on that. You can ask for nurses or chaplains. They can also fill into that role if you don't have an advocate in the hospital. These are some professional advocates that you can reach out to in the community. So if you're in a situation like I described earlier and you need to put your hand up and ask for help, these are people that you could ask for help from. And if they can't help you directly, they can probably find a resource for you in your community to guide you for assistance. This is the ombudsman definition I threw up there for you. So they're really more focused on public official grievances then healthcare. So that's the definition, that's the difference. Professional advocates they work within their scope of their training, okay? So in the medical profession, we have our scopes, and advocates, I believe, should work within their scope as well, because like in the medical profession, when everybody does that, It works well. We respect each other's scope, and we support each other in the scope, and overall, we work as a team. And I think that's where we need to go with advocacy, and we really we do really well to do that. Everybody working peer to peer, and then when they need to go up a level, call in a professional and let them take over. So this is one type of advocacy that we did. We were featured in a national magazine as an advocacy organization in fall. So that's another way. If you write. You know, we've seen art. We've seen 100 different ways. And I don't think people realize there's so many ways to get involved. There's instructed advocacy, where you're told what to do. There's non-instructed advocacy, where you trust me. Amanda, I can't deal with my insurance company. Here's the phone, and you walk away, okay? And there's a lot of barriers. And what are those barriers that don't get successful outcomes? There's some of the reasons: lack of time, knowledge, resources, professional or personal risk, loyalty to peers or providers. You know, there's a lot of reasons. So we want to make sure that we're cognizant of those before we go into the situation, so we can be strategic about how we approach. And like I said, remember the last thing on the slide before is we want to make sure that before we go in, we're tailoring what we're doing to that specific situation. And I just went back up for a second. The bottom one, I think that's the biggest one people encounter, right? Lack of access to the decision maker. So you might get in, you might talk to the janitor, but that's not really going to get you anywhere, right? So doing what you can to get in the room with the right person is the biggest challenge. And that can take some time. Persistence is key there. Going back and building the relationship with the janitor, third, fourth visit is the key to that, okay? And then support group leaders, they tend to have these special challenges. And if you're striving to become a national advocate or a national leader, as I said, connect with a national nonprofit. Let them help you. Let them train you. And where do you start? You start by learning how to tell your story effectively. The biggest barrier I see is we all have long, complicated, long stories, and we lose people by the second sentence, right? So really becoming an effective storyteller and being able to tell your story accurately with brevity, positivity, and respect is a good way to start. So the shorter you can get, the better you can do. So back to the first question. What does advocacy mean to you? Has this helped you broaden your idea of what it means, and what are your goals? So jot down a couple, take them with you, one or two, and think about that after you leave. How can you advocate in the community in the next year? And what can we do to help you? If there's anything you need from us, we'll be happy to help. We have a full advocacy team, and they will be available to answer questions or give you any support you need. And that is all we have. Don't get overwhelmed. When we come together and stand together, united to fight for what we believe in, we can accomplish amazing things. And we are as a community. We've come together and we've seen amazing success in the last 5 to 6 years. It will continue, and we'd love to have you with us. That's all. Thank you very much.